I guess if as students, younger osteopaths, new graduates, how do you measure accuracy? Is it patient outcome? Is it symptom change? Is it a change in your objective measures of the patient? Is it your accuracy of the application of force? What is it you define as accuracy?
If you've got the right combination of different levers involved, you feel the tension under your hand. You're nowhere near the end of mechanical range. You're in the middle, and you can feel that pressure building up under your hand. If you don't feel it, you don't thrust it. And you know you're wrong when you're thrusting and it doesn't work. And then your success rate goes up. Nobody gets to 100%, but you get to 98%. You're not at 50%, which most people are. Well, it's wrong, but I'll try it, and it doesn't work. Because you feel the tension in the joint under your hand, and you know you're right then. But other than that, I can't explain it accurately. It's one of those things that just, you know it's right. Yeah.
You've had a few years to develop this skill,
Yes,
I think.
that's the big problem.
Which I would say, to reassure our questioner there, that don't put yourself down just because you're a student, because actually very experienced osteopaths have the same problems, the same dilemmas, and what can you do? Just more and more practice is going to help, isn't it?
I spent 10 years working really hard on patients, full levers, everything. And then I started to introduce minimal leverage, and then I got better results much faster without hurting the patients.
Yeah.
And now if I'm working, they say, is that what you're going to do? Yes, because it's released, it's better. And I'm not concerned about the position. As soon as the joint lets go, that's it, it's done.